Hello, my name is Annika Rule and welcome back to my channel. So we're going to continue our discussion on asthma. I know if you didn't see the first part of this video, I did talk about just some irritants that could possibly trigger or an asthma attack. So what I'm going to talk about now is actually a medication that those who do have a history of asthma may be more familiar with. It's called albuterol inhaler or Pro Air. So albuterol inhaler is considered what we call a SABA or short-acting beta agonist. So what this means is that it's designed to act quickly on the lungs to decrease what is called bronchospasm. So when you have that wheezing situation that's going on, or when you're coughing that's been triggered by the lungs or the bronchioles or tightening or restricting the airflow, then that's when normally an albuterol inhaler would be initiated. Now, this is something that has to be prescribed by a provider, so you would have to get a prescription for this. So to say that, I've had sometimes my patients say, oh, he grew out of the asthma. Yes, a child can grow out of, the irritants causing that effect used to be. But if your child does have a history of asthma, always try to have a asthma pump on hand. When I say on hand, I mean one that's not expired, because let's say they don't use it as often, maybe once a year, which is good. You just always want to make sure you always have a non-expired one available. So that's something you should always keep in mind. So every time you go for that annual, just make sure you get a renewal for the prescription. The other one that expired, throw it out and then get a new one. So you can always have one that's valid and working on hand. Now, normally the inhaler is prescribed 2 puffs, 4 to 6 hours as needed. Now, the thing about it is that, especially if you have a child who's a school-age child who goes to school and takes it as a pump to school, you do want to tell your child that each time they take 2 puffs, each time they feel as though they need 2 puffs, whether they're having a shortness of breath or wheezing or excessive coughing, and as your child deals with this asthma, they'll know when they're going to have an attack or know their triggers and know when to initiate treatment. But do advise them to let an adult know. If you're in a school setting where you have a school nurse, just let that person know each time they take that pump. Because there's been cases, sadly, where the student is taking the asthma pump 2 or 3 times, and one, they're taking it before the 4 to 6 hours. And then it's only designed for a short period of time for an immediate asthma attack. It's not designed for long-term use. So just to make sure that they're informing the adult each time they use that asthma pump, so that the adult can know, okay, this is not working. Because one of the ways that providers that we measure to see if an asthma is being managed is the amount of times the patient does use the asthma pump. So if the child represents asthma pump 2 or more times per week, then that's something that we do want to be concerned about, because it means that probably the asthma is not being managed. So if you find that your child is in the pump 2, 3, 4 times each week, every day for the week, do talk to your healthcare provider about that, and do make notes. So when the child happens to use it, make a note of what triggered the asthma or why they used it. Now, one thing is that the albuterol inhaler, it can cause, and these are like known side effects, what we call tachycardia. Now, tachycardia is when your heart tends to beat faster. So with that, you can get a little bit nervous and you can get a little jittery. So I know I've had some times when my students get for the first time they use the asthma pump, and it's not as an uncommon feeling, because they're almost getting nervous and anxious. They don't know, okay, is it because I'm having this asthma attack why I'm feeling anxious, or is it because I took the medication? And I mean, as the child get older and use a pump, they'll be able to differentiate which is which, but it does cause side effect of tachycardia or nervousness. It does cause that. So it also can irritate the throat as well. So that's something also to be mindful of. So as I said, just keep in mind, use as prescribed. If you find a child using the asthma pump 2 or more times, do let the provider know. Let them know, okay, they're using it more than 2 times a week, so I'm also very concerned. So that's one thing I do want to follow up with it. So tips for this is keep an asthma pump for anyone with a history of asthma, a non-expired asthma pump to be sure. And if it's a case where, let's say the child is in between homes or they're in between different settings or environments, you do want to try to have one with the child, if the child is old enough to have one on their own, but also at those places where they frequently visit. So for example, school, mom or dad's home, if they freaking go to grandma for the summer, or have them take it with them, so at least someone there will be able to administer it in the event that they do need it. All right. So that is all for now regarding albuterol. We will continue discussion. I'm actually going to paste a link in the comments where you can go to the FDA website to tell you more about albuterol, and also how to use your inhaler. I did find a very good pamphlet on the FDA website talking about CDC, which actually CDC, that talks about how to use your inhaler. All right, so enjoy your summer break. Be safe and be well. Thank you for watching. Take care.